there were many changes on how we address, how we treat the disease. One of them was actually the higher use of neoadjuvant endocrine therapy, which was also one driver that took us to have more interest in assessing this setting, where we developed the meta-analysis that we presented here in San Antonio. So we saw more patients, mostly postmenopausal patients with luminal A-like tumors, so more sensitive to endocrine therapy, receiving more neoadjuvant endocrine therapy, because we faced many challenges at the beginning of the pandemic on how to prioritize patients for surgery, and also because hospitals were being shifted for COVID management, but also professionals were also being more useful to address the pandemic. And we also believe that it is important to continue studying the high susceptibility of cancer patients for developing infection, which was something that was already there, and with COVID was again intensified the interest in studying this. So that's why we also have in place at Institut Bordet a clinical trial assessing the immune response to COVID vaccination with mRNA platforms, which is actually also a technology of vaccination that is being used and developed for cancer vaccines. So it is important to understand how is the immune response of cancer patients to vaccination. And also another aspect that we are interested in is a cohort study that we are now developing at Institut Bordet with a quasi-experimental design before and after the pandemic, trying to assess how pandemic influenced the way we treat breast cancer, and if the outcomes, not only survival outcomes, but also complications from the treatment were later detected or not during the pandemic, as well, because we have this feeling and some data already out there that patients were diagnosed later in the disease course, so we might have more stage 4 at ab initio of the diagnosis of breast cancer, and also in patients with early breast cancer with more advanced stages between 1 and 3. So we are very interested as well in looking into how the pandemic impacted, so hopefully next year we can have more data to share with you.